If you've come down with the flu, chances are you were exposed to someone who showed no symptoms. Registered nurse Debbie Mulligan of Mission Hospital in Mission Viejo tells us what you need to know to combat its effect.
The flu is a virus, and so is the cold. So they fall in the same sort of category of a viral infection. The flu, when you get the flu, you know you have the flu. Generally, you have a very high temperature. Colds, you don't. With the flu, you have these body aches that make you feel like a truck's run over you. A cold, not so much. A cold, you will feel like you have, you may feel that you can get up and do a little work. A flu, you can't get out of bed. So typically with the flu, you see the high temperatures, the body aches and chills, a cough or sore throat associated with that. That's the flu. The influenza or flu is always associated with upper respiratory illness. You get it from somebody else. And I have to believe they don't mean to do this, but they have the flu and it's in their upper respiratory. So it's right up here, very close to getting out. And it's in their nose, it's in the back of their throat. And then they talk to you. And so as they're talking to you, they're shedding that virus, which if you're within 3 feet, you're going to pick up some of that virus from them, and you're either going to inhale it, or it's going to land as a droplet, or it's going to be on their keyboard that they were using, and you touch the keyboard, then you wipe your eye or your nose, and you stick that virus right inside your eye or nose. So you can either get it by droplet or by contact. Keep your hands off your face. We call this your T-zone. I know, I used to think that was for cosmetics. Not so much. This T-zone is your eyes and your nose and your mouth. Keep your hands off your face. That's the first thing. Okay, now you're sick, you cough or sneeze. We used to teach our children to cough and sneeze into your hands. That is absolutely the wrong thing to say. The right thing, cough and sneeze into your sleeve. Okay, that's good because the organisms or pathogens that are coming out of your mouth land into your sleeve and then they die. But on your hands, that has enough good stuff for them to keep viable. You know, a flu virus can be on your hand or on the doorknob for 2 to 8 hours after it comes out of your body. So you have to be careful.
What's the best remedy to combat the flu?
It's making sure that you're getting plenty of fluids. You want to keep hydrated. When people come to the hospital, it's typically because they're dehydrated. They're not able to keep ahead of the symptoms that they're feeling. And you feel really crummy. You don't feel like eating anything when you have the flu. Seasonal influenza and the H1N1 typically last a good 7 days. And you're sick, you are contagious all of that time. You're shedding that virus. In fact, the recommendation from the Center for Disease Control and Prevention, CDC, says, don't come to work until you are symptom-free for 24 hours. That's a long time. Those 60 years of age or older, those are the people that the seasonal influenza likes to attack. So it goes to the older people, and then it gives you the influenza, and then you develop pneumonia, get sick, maybe die. So we want you to be protected with the seasonal influenza vaccine. That's really important. The seasonal influenza also attacks the really young, the less than 5 years of age. So we want those kids to be protected as well.